A common issue faced by many clinicians as well as patients is the challenge of miscommunication of patient records. A lack of consistent records between doctor visits, coupled with the time it takes to transfer one record to a hospital, can have potentially fatal consequences, as sometimes it's very urgent that a doctor or a clinician gets access to the patient's records. The solution to this problem is to create a digitized platform where the patient has access to all of their own records and can easily update their records using the FHIR specification. That's what we provide with our application, SeCURE. SeCURE acts in many ways similar to the instant messaging programs we use on a day-to-day basis. The patient's mobile phone stores their FHIR encoded medical records. Whenever the patient needs to transfer these records into their clinician's device, they upload them into the protocol secondary server, which encrypts it end to end. This ensures that the data is secure at all times, and when the clinician has access to the data, they can then link it to their EHR platform of choice, and since it uses FHIR, it should be universally acceptable. The clinician will then have the opportunity to update the data and then store it into the app protocol secondary server, again using end-to-end encryption. Here's a quick demonstration of the technology. So joining the SeCURE application, we first enter our @sign, which is our unique identifier allowing us to engage in encrypted communications. Starting off as a patient, we can move on, and we have access to our dashboard. Now obviously there'd be some onboarding process where we input some of our own personal information like our first name and our just general statistics, but for the time being we'll go over what patients have access to at the dashboard. Immediately, they'll have the ability to transfer records to their physician. Upon clicking the button, they'll just be presented with this input field where they choose their physician's @sign, and they will be able to transfer their records securely using end-to-end encryption. The patient will also be able to view their own records and view modifications to their records so that they're always up to date on their own health. They'll also be able to view their own physicians' and clinicians' data and quickly access any changes that have been made to their records from this page.
So similar to the My Doctors page seen before, the doctor's side of this user interface is based on this dashboard that is in many ways similar to an email inbox. So every time a patient sends their records to the clinician that is the user, it will appear at the top of the page, and once clicking on it, the doctor will have the ability to view all of the patient records that are defined using FHIR specialization, and the doctor will have the ability to update the patient records by clicking on plus sign next to a specific category. This creates a specific note, which will be sent as a reply to this patient record, kind of like an instant messaging app. And this will reflect again on the My Doctors page for the patient side, and that will be a more organized view of just specific notes and prescriptions in order to make more accessible, like easy access to information than having to go through all the records to view the changes.